all about gout, brought to you by rheuminfo.com. Did you know that gout is a type of arthritis? In fact, it's the most common type of inflammatory arthritis worldwide, affecting roughly 3 to 4% of the population. Gout affects men much more commonly than it does women, with the first symptoms usually appearing between the ages of 35 and 50. Gout is caused by too much uric acid in the body. When these uric acid levels get high enough, the uric acid actually forms crystals. Now the body's immune system attacks these crystals, causing pain, swelling, redness, and warmth of the affected joint. To help you further understand this, we're going to introduce you to our gout sink. Imagine we have a sink, and this sink is full of the uric acid stored in your body. Every day, in your body, your muscles and tissues are rejuvenating. The purines in the DNA from the old muscle and tissue cells are broken down ultimately to uric acid. So uric acid is produced every day by your body. Every day, we eat uric acid as part of our diet. Animal meat is the most common source of uric acid, and any meat, even chicken or fish, will contribute to the uric acid load. Alcohol, especially beer and sugary drinks like soda, also increase the uric acid in your body. Uric acid is lost from the body through your kidneys, and it ends up in your urine. Now, if all things are in balance, you make as much uric acid as you get rid of, and the levels in our sink stay constant. But over time, our kidneys aren't as efficient at getting rid of uric acid. Now, this is a normal part of aging, and uric acid levels increase as we age. But uric acid levels can accumulate more rapidly in those who have more serious kidney problems and those who are prescribed water pills, also known as diuretics. Finally, there are some people whose kidneys work perfectly fine, but they just don't get rid of uric acid efficiently. This is a genetic problem and tends to run in families, and their uric acid levels rise faster than normal. As we get older, we also tend to eat foods richer in uric acid, and our bodies are also breaking down at higher rates. The result of this imbalance is a rise in the uric acid levels in our body. The first problem with gout comes when our sink overflows and causes a puddle of water on the floor. This puddle of water is like having an acute attack of gout. So with gout, you can see we have two problems. The first problem is the water on the floor, and the second problem is our overflowing sink. When we treat gout, we have to do two things. Number one, mop the water, which is like treating the acute attack of gout. And number two, turn off the taps to stop the sink from overflowing, which is like lowering the uric acid levels. Let's focus on our first task, mopping up the water. The first thing to understand is what causes the sink to overflow, or what triggers an acute attack of gout. These triggers include starting or stopping urate-lowering therapy like febuxostat or allopurinol, dehydration, trauma, for example you stub your toe, a recent illness or surgery, and finally excessive alcohol intake. So just how do we treat an acute attack of gout or mop the water off the floor? Well, we use medications like non-steroidal anti-inflammatory drugs, also known as NSAIDs. A common NSAID used to treat gout is indomethacin. We can also directly inject joints with steroids, which is quite effective. We can give tablets of prednisone, and finally we can give a medicine called colchicine. Now once we've got the water on the floor all mopped up, we can now turn our attention to the sink. Our second task is to turn the taps off on our sink to prevent it from overflowing. We can start by changing our diet by reducing or eliminating alcohol, eating less animal protein, such as red meat, chicken, fish, and other seafood, and by reducing our intake of sugary drinks like sodas and fruit juices. But sometimes simply altering our diet isn't good enough. We often need to use specific medications to lower the uric acid. These medications actually prevent our bodies from forming uric acid. There are two of them, named allopurinol and febuxostat, which is also known as Uloric. Both of these medicines are very effective for lowering uric acid. It's important to remember that you'll need to keep taking these medications to keep your uric acid levels low. Our target for our uric acid levels is less than 360 micromoles per liter, which is equivalent to 6 milligrams per deciliter. Why this level? Well, this is the saturation limit for uric acid, and crystals won't form at these levels. Reducing our uric acid levels will prevent future attacks of gout. High uric acid levels have also been associated with heart attacks and strokes, which gives us another good reason to eat healthier, exercise, and lower our uric acid levels. Now, one of the things that can happen in gout is we get the uric acid levels to target, but the attacks of gout continue. Here's an explanation. Our body is made up of tissue and blood vessels. The blood vessels run through the tissue and supply it with oxygen and nutrients. When we measure the uric acid levels, we're measuring the levels in the blood. But the tissue levels can remain high for some time and take longer to fall than those in the blood. Now, over time, as the tissue levels of uric acid fall, so will your attacks of gout. Unfortunately, this can take 6 to 12 months. There are a few gout rules that we have to follow to make sure you get the best possible treatment and result. Number 1, mop up the water or treat the acute attack of gout before you start to mess with the taps or lower the uric acid level. Number 2, once the water is mopped up, then start the urate lowering therapy, allopurinol or febuxostat. Number 3, you may need to keep the mop out as gout can flare when you start or stop urate lowering therapy. Number 4, do not stop urate lowering therapy during an acute attack of gout. Simply treat the attack of gout, mop up the water, but keep the taps turned off. Number 5, measure uric acid levels monthly to make sure you're hitting the target. We'd like to thank you for taking the time to watch this video. For more information, please visit our website www.roominfo.com.